Hey guys, hope everyone is doing well. Today we're going to talk a little bit about special populations since that is a big portion of what this course is all about. We're looking at what is a special population, how do we program for them, what sort of exercises should they do, what sort of things should they not do. So obviously this is an integral part of the class, so we're going to talk about that. So what we're going to do here, and I'm going to run through these things as quickly and concisely, but as much information as you need as possible. Um, I'm gonna share my screen at this point, and we're gonna run through the special populations PowerPoint that's posted here on Blackboard. So let me get that screen shared for you, okay? All right, I think we should be there. So at this point, we're just going to jump right into it, and we're going to run through this. And it's very important, like I say, because the way the class runs, we go from one special population to the next. We'll talk about what special populations those will be later in this talk, but what is a special population? That's the number one question of the day. What does it mean? It's just a group of individuals who exhibit medical conditions that impair health and functional ability, that have unique needs or concerns physically due to disease, injury, or lifestyle that put them in a common grouping. Um, Basically what it amounts to. It can be someone who is pregnant. All pregnant ladies would be a special population. Um, People with intellectual disabilities can be in special populations. People with diabetes, um, people who are overweight. Um, this is in contrast to it can be, let's say, again, youth or older adults, at the far ends of the spectrum. Those are special populations, whereas a middle-aged, good health male may not be in what you would consider a special population. So that's what we're talking about. There's an old adage that was said that active people seek active lifestyles, and that Darwin's theory of natural selection is going to apply to exercise. Um, it's hard to say whether exercise is associated with improved health or whether healthier people are more naturally drawn to do more active tasks. It could be a little bit of both. If you're healthier, you're going to feel like doing more. If you're not healthy, you won't be as likely to be drawn to active tasks. I mean, that's common sense, and we all know that. But I think if you start out in good condition and you're living a healthy lifestyle, then you're going to continue being active. Um, so in the 80s, there was some evidence that started to show that if people engaged in exercise over periods of time, they're going to reduce their chances of acquiring certain types of diseases like heart disease and other cardiovascular disorders. Now, we all know that is, to most of us, that's going to be common sense and matter of fact information. Also, research showed that regular exercise can reduce premature mortality, helping people to live longer through maintaining a healthier lifestyle. These results were independent of gender, places of residence, body weight, medical conditions, and family history. The concept of exercise has changed a bit. In the past 10 years or so, it's going into a new realm. And now researchers are looking closer at what the benefits or what the effects are of exercise on special populations, each specific group that we'll talk about. Most special populations are going to be under the care of a physician or some other sort of healthcare personnel. Back some past thoughts about exercise in special populations. At one time, it was thought that the added strain and stress of organized physical activity would further disable people who are already suffering from debilitating physiological conditions. These conditions would put them in groups that would name them to be special populations. Moreover, since certain pre-existing conditions increase the risk of complications or injury during exertion, experts assume that routine exercise would be more harmful than good. You see that one of the things that sticks out to me in this thought is pregnancy. I remember way back when, pregnancy was not looked at as a positive thing to do. Exercise was not something that was looked at as a thing that you should do while pregnant. It may hurt the mother, it may hurt the fetus. We all have started to see now that that's not the case, and that physical exercise is good for both the mother and the fetus. Now, so to prevent further decline in functional capacity, physicians and other healthcare groups, they discourage these special needs groups, special populations, from participating in structured exercise, which is very contradictory to what we're going to talk about in this course. So, current thoughts. Recent research shows what we all know is that exercise is beneficial for most populations. There may be some specific populations that don't fit that characteristic. The ones we will talk about will. Health professionals now believe or know that physical activity not only reduces the risk of chronic disease, promotes health and well-being of those that are already coping with long-term health issues. You're talking about feeling better about yourself if you're in better health. If you look better, you feel better. It all ties together. One thing to remember, and this is important, is that all individuals are going to require individualized exercise prescriptions. It's not something that you can just hand out when they come in the door. Here's your sheet, go do this workout. If you can't have a pregnancy workout plan where, okay, every time I see somebody with a baby bump come in, I'm going to hand them the pregnancy plan. You can't do that. They're going to be at different stages. They're going to have different levels of fitness starting out. They may have different ideas from their physician as far as what they should do. You may have one who has exercised for months coming into this, is used to exercising. You may have a pregnant client come in who has never exercised, but hears that it's a good thing to do to get in better shape to make her baby healthier. So you're going to have different situations with each person. Now, experts can categorize people with similar symptoms into specific special populations and give general guidelines for exercise. Now, we'll talk about those in class, and as you'll see, I'm not going to stress the specific guidelines for each group as much as I do the anatomy, what's going on, what should we not do, what should we do, things like that. The number of sets that we're going to do and things like that, I'm not as worried about that as you getting the information and the education about each specific special population, what's going on with them, where you can have the education to discuss the specificities of their situation individually when they come in to exercise. So, medical exercise program for special populations. This is important again. It is individualized for each person. Do not forget that. No two individuals are going to have the same type of program. Now, there are some universal guidelines that you can look at, such as proper monitoring before exercise, a proper warm-up, a proper cool-down, and you want to have new goals and objectives that are measurable, and you want them to be attainable. That's important because you're talking about special populations, people who have a disadvantage of some sort, usually, if you're going to be in one of these special populations. So mentally, they may not be in the best frame of mind. So if you set them a goal that they are not able to reach, it's just not doable, then you're not going to be helping that at all. You want to set goals and objectives that are attainable yet challenging, and that is challenging to do. to find out, and that's why it's so individualized. So make sure that we do goals and objectives. It's important to give them something that they can attain, but they have to work for, and then they feel good about themselves and feel better in general. So what sort of monitoring needs to be done prior to exercise? Blood sugar monitoring if diabetic, blood pressure if someone has issues, cardiovascular issues. You may need a temperature reading if someone is feeling ill. This is especially good right now during this whole COVID situation. Somebody may be on a weight loss path and they might want to get on a scale prior to exercising. Things like that, you want to, those are going to tell you how hard and long that person is going to be able to exercise. And it may vary from day to day. That's why you need to monitor them prior to exercise. When they come in, do they look energetic? Do they look good? Do they look healthy? Do they just look like they're not feeling good? You need to find these things out, figure out what's going on prior to just telling them to jump into it. So what does a proper warm-up consist of? Whether you're in a class full of students, by yourself, or a small group, it's basically just getting the muscle prepared for exercise. And you can do that through light aerobic movements, large muscle stretching activities, things that are just going to get you ready for the type of exercise that you're going to be doing. It varies according to the special population, as you'll see as we go through each one through the semester. Goals and objectives. The goals for therapeutic exercise are pain-free movement, improved functional ability, learning new body movements, perfecting technique on whatever type of exercise you're performing. Okay, pain-free movement, obviously we know that that's a plus. That's going to be an improvement for a lot of people. Improved functional ability, you're giving them the opportunity to do daily living activities easier or better. Some people may be sedentary and inactive, so you may teach them some new body movements, or they may be coming back from an injury or illness that has affected them, say someone from a stroke. They may be learning new body movements again. Now, the thing about perfecting your technique on whatever type of exercise you're performing, that's important for a couple reasons. Number one, you get the most benefit from the exercises when they're being done properly. Number two, it's going to cut down on the possibility of injury during exercise. So that's very important. Something to think about is therapeutic exercise. It's half education and half workout. I would say in these special populations, it may be even more education biased than what it says as half and half. It's very important to know the background of each of these special populations, what's going on anatomically, what's going on mentally, what do they need to know, what do they need to do, what should they not do, things like that, and we'll get into that. So part of the objectives is just teaching patients new skills and offering instructions on how to deal with the new movement that they're not used to having. Cool down is very important. We all know that. It may just mean a few stretches before going home. In these therapeutic situations, it's more important than in many other cases. It's a time where you can have proper breathing, reflection, and relaxation. It can be a time where you, as the leader, can give them a pep talk and say, look, you did great today. Think how much better you did this Monday than you did last Monday. It depends on each individual, but it's a good time to talk to them about goals, objectives, and things what do they want to reach? Do they feel like they gave 100%? It's a good time to talk. It also is a time that lets the muscles flush out the extra work they've been asked to perform, especially it feels like a lot for some of these that have been sedentary in the past and now are jumping into an exercise program. You want them to be able to function properly the next day without being incredibly sore. Now, a good workout a lot of times does mean you're going to be sore, and there's nothing that you can do with that, but a cool down will help to reduce that to a degree. So this is what we're going to talk about on each chapter. We're going to talk about each special population, and I'll run through those here shortly. We're going to talk about the anatomy and the physiology of each condition. Do they need a specialized screening procedure? If so, we'll discuss that. What benefits should they see out of exercise? A lot of them will be the same on each chapter. What cautions do we need to take? What observations do we need to make, either prior to exercise, during exercise, after exercise? What are contraindications? A contraindication is just something that indicates against. It says, don't do this. If someone comes in and their blood pressure is 230 over 130, that's probably a contraindication to just throwing them on a treadmill and going. So we'll talk about contraindications. And we'll also talk about modified exercise plans. In an exercise plan, really not just a modified one, you're going to have the mode of exercise, intensity of exercise, duration of exercise, the frequency of exercise, and the rate of progression. So what type of exercise are you doing? How hard are you doing it? That's the intensity. How long are you doing it for? And how often are you doing it? That's what you're talking about on your plan, and that's something you can come up with for basically anyone you're working with in an exercise setting. You need to take those, like I say, those can go into account whether you're prescribing exercise for someone who's 100% healthy or someone who has disease of some sort. It needs to be developed with careful consideration for each individual person. You need to look at their health history. What risk factors do they have? Strength and flexibility, you can check that up front. That's something that you can easily track and should be able to see gains in if that's something that you're working on. Excuse me, I'm sorry, I had a phone call. You also need to know what sort of orthopedic conditions they may have. If somebody has, if you're thinking about doing upper body exercise and they've had a rotator cuff surgery 6 months ago, that's something you need to know. Behavioral characteristics. Is the person energetic? Is the person excited to be there, or are they being, quote, forced by a doctor? Are they the type that needs a push? Come on, let's go, let's do this. Or are they the type that perhaps need you to just gently push them along? Notice those things. You can also ask about personal goals. What do they want to get out of this? And what's their availability of exercise facilities? Do they have exercise equipment at home? Do they have money to join a gym? Do they have a ride to get back and forth to a gym? Things like that. Those are things that need to be taken into effect in exercise plans, especially when you're planning out days and times and things like that. If they don't have availability to some of those things, then it's a factor. Okay. The research as far as exercise being used in medicine, has shown a lot of benefits. It's still in its infancy as far as research. Now, many health professionals, and this is a problem, and this is something that I try to work through in this class, and that's part of the reason why I teach it the way that I do. Many health professionals, doctors, etc., they hesitate to send their patients to health clubs, etc., because many of the employees aren't well versed in the medical aspects of disease for these special populations. They may be hesitant to send someone to a health club who has diabetes because they're afraid they're not going to know what to do if their blood sugar gets too low. So we're going to talk about things like that. As we go through each special population, we'll talk about specificities on all of those things. So the future of exercise with special populations, special medical populations, is gaining momentum. There's more outpatient programs cropping up. Some hospitals have offshoots, rehabilitation programs. We have that here in Oxford, where they do therapy services in addition to their acute patient care that they have to do. So what we're looking for can hopefully change through time is that, you know, there's a lot of money going out right now for medical procedures that could have been avoided through more exercise and healthier living. So we're hoping that maybe costs for preventative health care can go up, and they won't be spending as much on these medical procedures that could be avoided by doing more preventative health care, such as proper nutrition and exercise. If individuals know that there's exercise therapy benefits for special populations, then maybe they'll seek out instruction in their own community and make a change in that system. That's what we hope for. So here's some examples of the special populations we'll talk about. We'll cover most, if not all of these during the semester. Pregnant women, youth, how do we deal with them? Senior adults, people that are overweight and obese, cardiovascular disease, disorders of the skeletal system, diabetes, multiple sclerosis, asthma, people recovering from cancer, individuals with intellectual disabilities. I have a lot of experience personally. I worked at the NMRC, the regional center here in town, for 19 and a half years. So I've worked with individuals with intellectual disabilities quite a bit. So we may talk a good bit about that just because it's a lot of my background. Individuals with hypertension, people with osteoporosis, and that's kind of the groups that we're going to talk about, guys. I'm going to stop the share on the screen here. Hopefully that gives you a good rundown of kind of what we're going to be doing, what a special population is. There was some important information in that PowerPoint that will be on tests, so hopefully me talking you through it will be something that'll help it kind of stick in your mind moving forward. So thank you for tuning in. Look forward to seeing y'all again another time. Feel free to reach out to me if you have any questions, issues, etc. So you guys have a good day. Thank you.